Good evening, Los Angeles. Tonight I'm speaking to you again from my home, where I've been quarantining ever since my 9-year-old daughter, Maya, tested positive for coronavirus last week. And I'm proud and happy to report that Maya is doing well. And I'm relieved as a father that today she tested negative for the virus. My wife, Amy, and I have been so moved by the love of so many who've reached out to us in this trying time. People are so good in this crisis and are connecting with everybody who has the scare of someone in their household who tests positive for coronavirus.
Nicole cannot.
Amy and I have continued to test negative. And while we had this good news in our household, I'm going to cut to the chase. Too many households didn't receive that good news. They had loved ones whose symptoms got worse, or loved ones who became hospitalized, loved ones who were moved to the ICU, or even worse, they received the news that their loved ones won't be coming home, not for these holidays and not ever. Today, the county told us that in the last 24 hours, they learned that 145 Angelenos lost their life. A new peak, a new record of deaths in our county in this pandemic. We know that this emergency is our darkest day, maybe the darkest day in our city's history. But we must find the fortitude. We must summon the strength to make sure that we save lives. Virtually everyone is doing so much, but also each one of us can do something more. We can decide to take one fewer trip to the stores. We can wash our hands for 10 more seconds. We can wear our masks indoors if someone's been exposed. This is the moment for all of us, even those who have done the most, to do something more each and every day, to tighten up the bubbles around us, to fix the leaks, and to make sure that more people are here a year from now, together, to celebrate the holidays with one another. As you make the decisions in the coming days of what you will do, I want you to think about the doctors and the nurses and the janitors and other people working in our hospitals who don't even have the time or opportunity to celebrate Christmas at home, who are taking on yet another shift on New Year's Day. And think about their lives. Think about the wrenching decisions that they are making and the trauma that they are witnessing as people die in front of them. I want you to think about the loved ones around you who you want to protect and those loved ones you yearn to be by. Maybe you have even made plans after everybody testing to go visit. And I want you to cancel those plans. I want you to stay safe, and I want you to protect their lives. I'm not asking you to have false hope. I'm asking you to follow the facts. We know that as the weather turns warmer, transmission is likely to drop, so it will be safer in the coming months. And doctors continue to learn how to treat this better. Vaccines, thank God, because of the human ingenuity and the resilience that we have started to come forward. And within months, the most vulnerable residents that we have will be vaccinated, something I'm going to update you about tonight. Hope and health are just ahead of us. But that's no reason to let our guard down. It's no reason for a Christmas wave to build on a Thanksgiving wave that's nearly drowning us already. So just a little bit more. As I said, today was the single deadliest day in Los Angeles County since the start of this pandemic. With infection surging, this is the wrong moment to get or to spread COVID-19. We're seeing evidence in other countries, and we're researching here whether there's new mutations of this virus that are spreading even more quickly. It's time to double down on the things that we know, the wearing our masks and washing our hands, keeping our distance, canceling our plans, taking fewer trips out of the house. And the conditions in our communities are very dangerous. We had 16,525 new infections in LA County announced today. 5,638 of those in the city of Los Angeles. That's a 30% increase day over day, and more than 5 times the amount of hospitalizations since last month. Midweek is usually a peak, but we've got to make sure that this absurdly high number at least begins to level off. And we're seeing the virus spread across sectors, including in our own city workforce, with nearly 400 cases, new cases, in our city workforce this week. And I implore every one of the beloved members of my city workforce family, from firefighters to police officers who are continuing to answer the call of Angelenos, from Rec and Parks to DWP staff, to those who work alongside me in the mayor's office day after day after day, to continue to carry out your extraordinary work with extreme caution. Your work is essential, but so too is the safety at your home and your workplace, and you can't be too careful. As I speak to you tonight, 6,499 of our fellow Angelenos are hospitalized. This is the highest number again since the start of the pandemic, and over 3 times the number it was just last month. And of those, 1,280 patients are severely sick in our ICU, up 3.7% since yesterday and 167% since last month. The county may be rapidly nearing a system-wide crisis care declaration for our hospitals. And we've begun to see those images. We give you averages of ICU capacity, but we know that already in many of our hospitals, they've reached that breaking point. We see the images online and on television inside our hospitals of bedridden COVID patients that are lined up in the hallways, others who are receiving oxygen in their tents, in parking lots, doctors and nurses who are traumatized and overworked and simply exhausted. And please do everything you can to thank them, to send them something, to ring those bells, to do whatever it takes to let them know we see them and that we love them. This is happening at a pace that's both unsettling and unsustainable. If we continue to spread this virus, if we see a linear growth of this for the next 2 weeks, we will not have enough medical staff to treat everyone. And hospitals may soon be in the position of having to ration care. That means that doctors will be forced to determine who lives and who dies. And more Angelenos will lose their lives, not just to COVID-19, but to other medical emergencies. As I mentioned, COVID-19 deaths continue to climb. We said this would happen. When the cases went up, we said a couple weeks later the hospitalizations would, and they have. And I said a couple weeks later the deaths would follow, and they too have. 145 of them, as I mentioned, 43 new deaths in the city of Los Angeles. The single deadliest day in the pandemic in Los Angeles, we've never experienced so much loss. And to every family who lost someone, I'm so sorry. I'm so sorry for your loss. And it makes me even more determined to do everything we can to save more lives. The risks of this disease increase exponentially with our age. And more spread means that older Angelenos are even more at risk than ever before. 3/4 of all of our deaths have been Angelenos who are 65 and older. I know nobody over 65 feels old. You feel vibrant and ready to conquer the world, to contribute so many days, but please look after your health and stay isolated. It's not always just the kids who want to visit the parents or the grandparents. Sometimes it's those of us in our golden years who just think that if everybody's tested, maybe we can get together for a couple hours on Christmas. But let me put it this way. If our parents and our grandparents do what's right and we do what's right for them, they're more likely to be here next Christmas, the Christmas after that, and for many more years to come. In just a few months, most older Angelenos will be at much lower risk of suffering from COVID-19. You see, in LA, we're not just waiting for that day to come about, we're making it material. We're bringing that about as quickly as possible. And together with our LA County partners, we're implementing a vaccination strategy that builds on our unprecedented testing infrastructure that we've built for months with so many brave public servants and volunteers. And we're going to deploy vaccines equitably and effectively across neighborhoods and across sectors. And tonight I can announce a major milestone in that effort, a campaign to bring the Moderna vaccine to the staff and residents of our skilled nursing facilities across Los Angeles. The critical need for this couldn't be any clearer. You remember early on the number of deaths that we had in our skilled nursing facilities. Just 5% of Californians live in these facilities, but they accounted for 35% of the deaths. So here in LA, we were the first city to mandate that testing, the first big city to surge strike teams with our firefighters and tests to our skilled nursing facilities to help them test and treat. We made sure that we were focused on those who are most vulnerable, and we cut those deaths by 80%. So now we're going to build on that and make sure that we get the vaccines to those residents and workers as quickly as possible. We're deploying those same mobile teams to vaccinate these Angelenos, our most vulnerable neighbors and family members, at a rate that meets the urgent demands of this moment. And I want to thank our extraordinary partners and leaders at the County Department of Public Health. I want to thank our supervisors, led by Hilda Solis, our new board chair, and her colleagues. And I want to thank Curative, our testing partner, who's helping bring this program from dream to reality and delivering vaccines. We already delivered them to the first 17 nursing facilities yesterday. And by the end of this month, we will deliver 69,000 vaccines at 339 skilled nursing facilities across Los Angeles. All of us have done so much, but all of us can do something more. Stay at home whenever you can. Seal the holes in your bubble. Help us avoid a worst-case scenario in our hospital by keeping your gatherings virtual. And Zoom has made that easier by lifting the 40-minute limit on meetings for free accounts for Christmas and Kwanzaa and New Year's. And let's ensure that every business heeds public health guidance, because if data shows that particular sectors or settings are becoming vectors for COVID-19 transmission, we will have no choice but to shut them down. That's not just bad for our economy overall, that's bad for our workers and our families who count on those businesses for jobs and for income and security. Most of all, keep wearing your mask. If there's been exposure inside the house, wear it inside the house. Still one of the most powerful tools that we have. One estimate says that 30,000 lives can be saved by the vaccine this month and 50,000 just by wearing masks. And you can promote the wearing of masks by what's been our beautiful campaign of artists locally here in this creative capital of the world, and download one of the posters that has been designed locally at LA Mask Print Project, and choose from a catalog of prints from diverse local designers, including the original Studio #1 print, which you can see standing tall outside LA Children's Hospital right now. Since we launched the LA Mask Print Project in July, we've had over 27,000 unique visitors to our website, countless downloads, who are local artists being downloaded in other cities and countries. And tonight, I can announce that we've added work from 11 more artists this month, including a very talented 6th grader named Mira. Thank you, Mira. Promote mask wearing and find all those prints at coronavirus.lacity.org/maskart. Finally, if you have COVID-19 symptoms, you've heard me say, you know what to do, get tested immediately and quarantine until you've received a negative result. And if your test comes back positive, I know how confusing the numbers were. If you've been exposed to someone, or if you have a positive test, the number is the same, 10 days. 10 days of isolation if you're positive, 10 days of quarantining if you've been exposed. And remember, if you had a positive test, wait for 24 hours after your last fever. As of this week, we've given 3 million free tests to the people of Los Angeles. Again, with our extraordinary partners countywide and in the city sites, our firefighters and our core volunteers. Our current 7-day positivity rate in our city sites is 20.27%, down very slightly, but at least it's not up today, at least a slightly hopeful sign. Testing remains a critical tool in getting things under control and keeping the latest data that we can track, and where we can deploy our mobile testing teams and how to strengthen our response. You can see, as I announced earlier this week, what those trends look like in your neighborhood with our new COVID-19 neighborhood map. a tool developed by my office that shows the latest data across 139 neighborhoods. And you can check that out at coronavirus.lacity.org/map. And with that kind of information in hand, you have the power to be able to know where you live and what you can do. On top of that, we've added to meet this moment even more tests yet again, 5,000 daily testing appointments added to each open day this week, bringing the total capacity to 46,400 tests each day at just the city sites alone. You can always go to your own health provider, the great county sites, CVS and other providers, Walgreens, by going to coronavirus.lacity.org/testing or call us at 311. And as a reminder, because of the holidays and the amazing volunteers who are taking a little bit of a break, besides Kedron, which will be open tomorrow, all the other sites will be closed tomorrow for Christmas Eve and Christmas Day. They'll be back open on Saturday and stay open for the days leading up to New Year's, or New Year's Eve and New Year's Day. They'll be closed as well. But every other day they will be open, and thank those volunteers, thank those firefighters who are working hard to make sure we know your status. In this perilous moment for our city and for our nation, some things can't wait, but many things can. While we can't wait to surge our hospital capacity, we can't wait to do something more, we can wait on getting together and even celebrating some of our most cherished traditions with others. But we can't wait for the relief that we need for our most vulnerable residents. This is another place where Angelenos are doing so much, and another place where we can do even more. In the work we've done to lift up those who have fallen down, I have been blown away by the generosity of Angelenos. And I'm going to ask you to continue to do even more right now in this season of giving. We've worked so closely with our partners at the nonprofit Mayor's Fund for Los Angeles to launch 2 critical relief initiatives throughout this crisis. The first was about groceries and basic necessities for families, the Grocery Intervention for Vital Emergency Needs, or GIVEN initiative. And I can announce that thanks to a $3 million anonymous donation, and I want to thank those donors so much for their generosity, that initiative is fully funded for our initial goal, meaning we can reach 10,000 in-need households with $300 in cash assistance during the holidays. This donation and the donations of so many of you, whether it was $5 or $25 or $125 or more, it's a testament to the Angeleno spirit, to how we lead with love, and we're deeply grateful. Second, our initiative to help restaurant workers hard hit by the closures from the state that demand that outdoor dining ends. We want to make sure that those restaurant workers get through these holidays with an $800 cash assistance for them and for their families. It was the Secure Emergency Relief for Vulnerable Employees, or SERVE program. And our goal was to reach 4,000 workers with donations, and we have. And I'm glad to report that that assistance was delivered on Monday, and in just 36 hours, 75% of the recipients accessed their funds, a painful sign of the profound needs of so many in our city. And we're so grateful for the large anonymous donation we just received, and equally in awe of the more than 10,000 Angelenos who gave. I'm going to ask you to keep giving, because we're not going to stop giving those funds with 0% overhead to a family. If you're last minute shopping for presents, throw in $300 for a family to have groceries, or help a restaurant worker get through these times. Again, at mayorsfundla.org. But here's the heartbreaking truth, Angelenos. While these programs will help support thousands, tens of thousands of families across our city, there were thousands more that did not receive assistance. So your help will help them get through. These programs, and programs like the ones that our city council and I have stepped up to work on for rental assistance and utility assistance, and I want to thank my colleagues on the city council for the way that they prioritize those CARES Act money together with us to help everyday people. We see in Washington that the big corporations always get bailed out, but we wonder, will money go to those in need, who are trying to pay rent, or make up with their student loans, or who have a medical bill that's long past due? And I was glad to see this Congress move forward with some assistance that included rental assistance and, yes, some direct assistance in the latest COVID-19 relief bill, because we know what happens when we put cash straight into people's pockets. Poverty goes down, spending goes up, our economy is strengthened, and our communities can hold on in this, our toughest moment. What passed in the House and the Senate was long, long overdue. It's a long overdue first step, but I have to be honest, in so many ways, it was too small and it was very late. Last summer, I supported a proposal from Senator Harris, our next vice president, and Senator Sanders to provide a $2,000 monthly check to those struggling to get by as a result of this pandemic. $2,000 every month until this pandemic is over. Imagine what that could have done to keep families together, to have closures without worrying about whether companies and workers could survive, rents paid, lives saved, because people wouldn't have had to put themselves in danger to get one more shift to meet their bills. And I still support this idea and echo Speaker Pelosi's call to pass without objection President Trump's request and to increase the level of direct stimulus to $2,000. And I would encourage Congress to keep that going until we are out of this crisis. That needs to happen right now. And it's time for our federal leaders to meet this moment and to do what we sent them to Washington for: get the job done. I know, my friends, that this is not the holiday season we want. I know the pain that so many of us have held and the fear. In times of such deep uncertainty, we fall back on what we know and what we value most. We return to the rituals and the customs and the people who have brought us comfort and remind us of our very best selves. We yearn for that comfort in this moment of doubt. Even in our darkest days, we turn to prayer and to each other. We celebrate these holidays in this season that represent light and hope and rebirth. But in this holy week for so many, we recall the words of Scripture. Weeping may stay for the night, but joy comes in the morning. And as the 126th Psalm says, those who sow with tears will reap with songs of joy. With songs of joy. Morning is coming, Los Angeles. And when it finally arrives, joy and love and hope will come too. With new memories, a new appreciation for life, and new heights of happiness with the people that we love the most. We will get through this together, as long as we keep doing a little bit more. Not some of us, but all of us. No matter how much we've done, we do something more. So please hold off on those gatherings. Cancel those plans. Stay safe and stay healthy. Stay alive and stay at home. I want to wish you, from my family, a very Merry Christmas and happy holidays, and plant the seeds of hope for a new year that brings health and hope to all of you, sending you all strength and love. With that, I'm happy to answer questions.
Thank you. And we go to the line of Steve Gregory from KFI. Please go ahead.
Hey, Steve.
Mr. Mayor, happy holidays.
Thank you. You too.
And I just want to also extend that my sincere wishes for your daughter's recovery.
Thank you. Appreciate it, Steve.
I've got a couple questions real quick.
Of course.
I want to find out, testing sites right now are overwhelmed, and I'm sure it's because of the holiday push and this false sense of security that we get a negative test and they can go and do what they want. But I'm just wondering if these testing sites continue to get overwhelmed, are there any plans to expand existing sites or add more? Also, when do you and your family get in line for the vaccine?
The other interpreter's not up.
If that, because of what's gotten on with your daughter and your family and everything now, do you get in line with the vaccine any sooner than later, or what order are you? And finally, would you consider a tighter, safer at home order even if the county doesn't issue one?
Sure.
And happy holidays. Thank
you very much, Steve. You too. And thank you for the good wishes for our daughter. Let me work backwards. I support our public health advice. I don't just accept it blindly for those out there who think that we are elected to assess those recommendations, but I have always backed those up. So it would take something extraordinary for me to go against that public health advice, which right now, Dr. Ferrer has been pretty clear, quote unquote, harder closures may not result in anything when most of this is community spread overwhelmingly. But if tomorrow they say it's that bad and we need to, yes. And I always do talk to other folks around the country and look around the world. So I would always consider that, yes. And I will always support public health recommendations on that. We don't have our own health department, so I don't want to make those sorts of assumptions without talking to people who really look at the data, but we've got a whole team. And right now, what this is about primarily is the severity of the season, probably the mutation of this virus. We've better prepared our hospitals, but if those numbers continue to go up, I think everything has to be on the table, and we have to be willing to act swiftly. And if folks won't act, certainly I would. Secondly, in terms of vaccine, I'm going to wait my turn. I know I'm an essential worker, but I'm not a frontline essential worker working with COVID-19 patients or other things. I have to do many things as your mayor, and I have to stay healthy. That's why it was important for me to quarantine, et cetera. But no, not as an elected official. I'm not going to jump that line, nor will my family. We will wait for our turn. There are people who are more vulnerable than me who need to get that vaccine first. And then third, the testing, not new sites, but we continue to add capacity. And there will be a pinch because of the 4 collective holidays over the 2-week period. When folks are just exhausted, like I said, we have always relied on the incredible work of a lot of volunteers. We don't have enough money to just pay for everybody to be a paid employee at these sites. And so they need a little time off. But we surge up before and after. And because of the cases, we've gone from doing about 12,000 tests in our capacity a day to 46,000 in just over 6 weeks. So it's much better to keep the same sites, kind of surge them up. We did add a site recently, obviously, the walk-up site in San Fernando Park, because we saw a huge spike in the Northeast San Fernando Valley, and we wanted to respond to that quickly. If we were to see that in another geographical area that's not well covered, I'd consider that. But this is really about adding more tests. And I do want to thank our partners, whether it's LAFD, whether it's CORE or Curative, who are still able, even with these amounts. I want to say something special, and they're probably working so hard they won't even hear this. But the people who are turning these tests around, probably in windowless rooms, where we're saying, why are the test results not coming back more quickly? These are people doing those. And LA, I think, has the best record in the country. We've had 1 or 2 pinch point moments earlier in the year when we had surges, but they have done a heroic job. And I want to thank every tech who is in a lab right now with thousands and tens of thousands, hundreds of thousands a week of tests that they are making sure we get the results back in a timely way. You have saved lives, and I thank you. So we'll continue building that capacity. We know it'll be tough, and some people for the first time in months will have to wait a couple days because of those closures, but you're not going to be waiting weeks to get a test, and you're going to get those results back consistently within that short time period of a day or a day and a half. Thanks, Steve. Stay healthy. Next question, please.
And now to the line of Albert Cerna of Well Health. Go ahead.
Hey, Albert, how are you?
I'm good, Mr. Mayor. Thank you for taking the time.
Of course.
I hope that your daughter is recovering well.
Cheers. Thank you.
I wanted to ask first, it was announced that California inmates most impacted or most at risk are going to be receiving the vaccine. Have you spoken with the supervisors yet to plan for juvenile detention centers to get this vaccine? I also wanted to ask if the numbers for the testing site in Boyle Heights have gone up, or do you have any data for that information?
Sure. I don't have the Boyle Heights number, but I'll have somebody from my team follow up with you and get you that tonight, Albert. In terms of the juvenile centers, I think my understanding is, of course, the most vulnerable inmates will go first in terms of folks who have pre-existing conditions and who are more elderly. But the plans are to go to everybody because everybody in a congregate setting is at high risk. And we have seen a lot of spread happen. And even if younger people usually recover just fine from this, we can't even have 1 or 2 deaths come out of this, let alone the spread to the workers that are there too. So yes, we have talked about that. They are high priority and will be a part of that. But I know they start with the older inmates first and those that have pre-existing conditions. But we'll get you the data on Boyle Heights, okay? They may be up on the map that I mentioned, so check that out, but we'll see too if we can get you the latest numbers. Thanks, Albert. Next question, please.
Thank you. And then from the line of Matthew Blake, Real Deal. Go ahead.
Hey, Matthew, how are you?
Good. How are you doing, man?
Good, thank you. You too.
Thanks a lot for the time. To switch gears just briefly, the former Deputy Mayor, Ray Chan, was indicted earlier this month, and Nicola Hanna, the federal prosecutor, said in a statement that the indictment of Mr. Chan and Jose Riza should
prompt a serious discussion of whether significant reforms are warranted in Los Angeles city government. So I just wanted to get from you whether you agree with the federal prosecutor first off, and if so, whether there are specific reforms that you might like to pursue through the rest of your administration.
Absolutely, 100%. I mean, I think that it's time for us to look at charter reform again in Los Angeles across a whole host of areas. It's been over 20 years, and I think you always want to keep things updated, the highest ethical standards, close as many loopholes, modernize government, et cetera. And this should be a part of that discussion. Luckily, I do agree with the U.S. Attorney, and some of that work began before the indictments came down, when we even heard about the investigations, thanks to the City Council, my support, to be able to close loophole on donations from developers, for instance. A few years before that, when I was on the City Council, leading that lobbyists could not give directly. And I do think that we should be looking, one specific reform that I certainly would support, and I know some City Council members have talked about, is if you are going to get donations from anybody, whoever has business in front of you at a certain time period, you can't vote on those things. That's what we do at Metro, LA Metro. You can't vote on a contract from somebody or somebody's family member or associate who's given money to you. So there's never even a hint of the temptation of somebody voting because it's a friend of theirs who supported them. And I think that is a way to close that. On the other hand, too, bad people will always find a way around things. And I hope that they are prosecuted and pay the fullest price for what they do in abusing the public trust and breaking the law. And I've learned over time, you can't come up with enough laws to stop all bad behavior. People will break the law, but it is our responsibility to tighten those up. And I think a good next step would be to make sure you have to recuse yourself from any vote where you've received that sort of donation in a certain time period. And that would, and a generous time period, not just very recently. And that would, I think, take away the temptation of a lot of people to give money to politicians. That wouldn't stop what happened, because this was not about legal donations. This was about illegal bribes. And at least that's what the accusations are. It's tough to outlaw something that's already outlawed, but I hope all of us will find ways to root that out. And anybody who ever breaks the law better be prepared to have the book thrown at them and to pay the price. Thanks. Next question.
No more questions in queue.
Okay. Thank you all. Again, I wish you all a very, very Merry Christmas if you're celebrating, a safe one at home with your household. God bless you all. And I'm going to now speak in Spanish. Muy buenas noches, Los Ángeles, y gracias por venir. Esta noche les hablo de nuevo desde mi casa, donde he estado en cuarentena desde que mi hija Maya dio positivo en el test de COVID-19 la semana pasada. Maya se siente bien y me alegra informarles que hoy tuvo un resultado negativo. Mi esposa Amy y yo hemos sido tan conmovidos por los buenos deseos de todos. Muchísimas gracias. Amy y yo seguimos dando negativo. Estamos transmitiendo a través de Zoom de la misma manera que celebraremos las fiestas esta semana con mi familia. Esta noche quisiera empezar con un mensaje muy claro. Este no es el momento para reunirse en grupos. Este es el momento de redoblar sus esfuerzos para protegerse de este virus. Usar mascarillas, mantener la distancia y evitar las reuniones. Hoy mucho pasando de manera virtual. Todos podemos hacer más. Un viaje menos, lávase las manos más, y ni siquiera piensen en ir a la casa de tus padres en Navidad. Las pequeñas acciones marcarán una gran diferencia. Hay enfermeras y médicos que ven morir a personas y que no tomarán tiempo libre para Navidad y el Año Nuevo. No viajes, cancela tus planes, por favor. Sabemos que cada reunión es más peligrosa en este momento. Espere unos meses para saber cuándo será más seguro. pero también sabemos que todo estará más seguro en solo unos meses. Hoy tuvimos 16.525 nuevos casos en el condado de Los Ángeles, con 5.638 en la ciudad de Los Ángeles. El 30% más desde ayer y 5 veces más de hospitalizaciones desde el mes pasado. Y hay más de 400 casos nuevos en la fuerza laboral de la ciudad de Los Ángeles desde el viernes. Esta noche hay 6.499 personas hospitalizadas con COVID-19, el número más alto desde el inicio de la pandemia y más de 3 veces más desde el mes pasado. Y 1.280 pacientes están en las unidades de cuidados intensivos. Es posible que el condado se esté acercando rápidamente a una declaración de crisis en todo el sistema para nuestros hospitales. Todo esto está pasando a un ritmo muy preocupante. El personal médico pronto tendrá que determinar quién vive y quién muere. Las muertes por COVID-19 siguen subiendo. Hoy nos enteramos de 43 nuevas muertes en nuestra ciudad y 145 nuevas muertes en nuestro condado. Un récord. Más del 74% de todas las muertes ocurren entre personas mayores de 65 años. Lo siento mucho por las familias que están sufriendo el resultado de su pérdida. Pero junto con el condado estamos implementando una estrategia de vacunación que se basa en nuestra infraestructura de pruebas e implementa vacunas de manera equitativa y efectiva en vecindarios y sectores por las edades en más riesgo. Y esta noche puedo anunciar un hito importante en ese esfuerzo. Una iniciativa para administrar la vacuna Moderna a personal y residentes de ancianos en Los Ángeles. Este esfuerzo es crítico. Mientras los residentes de estos hogares representan solo el 5% de la población de California, representan el 35% de todas las muertes por COVID-19. Esta iniciativa está desplegando equipos móviles para vacunar a estos angelinos de manera urgente. Para fines de este año calendario, nuestro objetivo es implementar aproximadamente 69,000 vacunas en 339 instalaciones en todo el condado. Todos tenemos la responsabilidad de proteger a nuestra ciudad y ayudar a nuestros hospitales. Quédense en casa y no se reúnan con personas fuera de su casa. Y sobre todo, siga usando una mascarilla. Puede promover el uso de mascarillas mostrando los diseños del proyecto artístico de mascarillas LA. Incluso la obra original de Estudio No. 1, que aparece ahora en banderas en frente del Children's Hospital de Los Ángeles. Esta noche estoy anunciando que hemos agregado arte de 11 artistas adicionales, incluyendo un joven del 6º grado, Mira. Encuentre todos los diseños en coronavirus.lcity.org/maskart. Finalmente, si tiene síntomas de COVID-19 o cree que haya sido expuesto, hágase la prueba y póngase en cuarentena hasta que reciba un resultado negativo. A partir de esta semana hemos realizado más de 3 millones de pruebas en sitios de la ciudad y la tasa de positividad en los sitios de la ciudad es del 20.27%. Y visité coronavirus.lcity.org/testing para coronavirus.lcity.org/map para encontrar una mapa con las últimas cifras de casos y muertes en 139 áreas de la ciudad. Con esta información hemos podido agregar 5,000 citas de pruebas diarias esta semana, logrando la capacidad de administrar 46,400 pruebas cada día. Durante las fiestas, en el 24 y 25 por la Navidad, estos sitios están cerrados, y por el 31 y el primer día del nuevo año. Pero todos los otros días estamos abiertos. Les recuerdo que nuestros sitios de pruebas están cerrados durante estos días, mañana y viernes, pero volveremos a abrir el sábado. Visite coronavirus.lcity.org/testing o llame al 311 para hacer una cita. La ayuda federal para nuestros residentes más vulnerables se necesita ahora. Y por eso que hemos colaborado con Mayor's Fund for Los Angeles para lanzar iniciativas que ayudan a familias en dificultad. Y esta noche tengo noticias sobre 2 programas con ellos. Primero, el programa Given ha recaudado una donación anónima de $3 millones al Mayor's Fund para ayudar a 10,000 familias con $300 en asistencia en efectivo durante las vacaciones. Y segundo, estamos muy agradecidos por la gran donación anónima que acabamos de recibir para el programa SERVE, e igualmente asombrados por los más de 10,000 angelinos que han apoyado a sus vecinos a través del fondo de la alcaldía durante este momento difícil. Entonces, si tienes $3 millones o $3 o $30 o $300, necesitamos su ayuda. Una familia, un trabajador necesita su asistencia. Por favor, visite mayorsfundla.org para ayudar. Estos programas pueden marcar la diferencia entre la esperanza y desesperanza para tantas familias trabajadoras en Los Ángeles. Me alegré saber que el Congreso incluyó asistencia directa en el último paquete de alivio de COVID-19. Lo que aprobaron en la Cámara y el Senado el lunes es un primer paso muy importante, pero todavía no es suficiente. El verano pasado apoyé una propuesta de la senadora Harris y el senador Sanders para proporcionar $2,000 mensuales a personas sufriendo económicamente a causa de la pandemia. Sigo en apoyo de esta propuesta y espero que Speaker Pelosi responda a la petición del presidente Trump y que aumente la cantidad de estímulo a $2,000 ahora y para cada mes de esta crisis. Amigos, hermanos y hermanas, sé que esta no es la temporada navideña que queremos, que merecemos, que necesitamos. Pero en esta Semana Santa, recordemos las palabras de la Escritura. El llanto puede quedarse durante la noche, pero la alegría llega por la mañana. Saldremos de esto juntos. Así que cancelen sus planes, manténganse seguros y saludables y quédense en casa. Feliz Navidad y felices fiestas y fuerza y amor, Los Ángeles. Gracias.